This is Dr. Dwaipayan Ghosh, consultant pulmonologist. Today we are going to discuss about an extremely concerning issue in today's world, that is management of a patient who has both high blood pressure, that is hypertension, rather systemic hypertension, and also high blood sugar, that is diabetes. Now, we the doctors consider this coexistence of hypertension and diabetes in a single patient as something called the deadly duo. So why this? Because when these two diseases go hand in hand, they mostly try to target to damage a few common organs in our body, and that too together. As for example, the coexistence significantly increases the risk of our cardiovascular problems like the heart disease, the stroke, as we call it in a layman's language. And why this happens actually? That is because in high blood pressure, in an easy language, our heart tends to pump a larger amount of blood, and by working more and more, the heart and the blood vessels that get strained, and both of which we remember that were already damaged due to the pre-existing diabetes condition. So basically, it's a combined detrimental effect. Now, most of the international bodies in our field say that the common complications of diabetes, like nephropathy, that is, the kidney problems, the retinopathy, that is, the eye problems, they certainly appear much, much earlier when there is a coexistence with hypertension or high blood pressure. Even the few recent studies also mention that in this coexistence, you even have an increased risk for dementia, Alzheimer's disease, since the blood vessels in our brain are often susceptible to early damage, early detrimental affected because of a few mechanisms like diabetic angiopathy in one hand, and because of high blood pressure, persistently high blood pressure in the other hand. So, dual mechanism of damage it is. So, having discussed all of that, naturally the next question is, how do we prevent this condition? There are many options available. There are many recommendations available. The American Heart Association, they recommend that 150 minutes per week of mild to moderate intensity exercise is must. What is that? Like jogging, brisk walking, etc. They also mention that 75 minutes of vigorous exercises will help you actually lower both the blood pressure and also to strengthen your heart muscles alongside with a very, very good control of blood sugar level. But here is a catch. The catch is that before you start to hit the gym to start with a vigorous exercise, I personally would suggest you that you must take opinion from your local doctor, as we often see that this sudden initiation of exercises, suddenly hitting the gym, in these cases, in these patients of coexisting diabetes and hypertension, they often lead to hypertensive heart diseases complications per se. So before you hit the gym, go and seek permission from your doctor. If needed, go for a TMT test or anything which is relevant. The American Heart Association, as well as some other bodies concerned with these coexisting diseases, they mention that in your diet, in your daily diet, do limit the intake of daily salts, high fat meats, and whole fat dairy products. They also recommend to increase the amount of low sugar diet, like where the amount of carbohydrate should be low, like leafy vegetables, fresh fruits, fish in particular, and so on and so forth. Even a good sleep of 6 to 8 hours is also recommended. A stress-free life, as we all know, are obviously recommended. So maintaining a healthy lifestyle, a healthy body weight, are major concerns and major points in controlling both diabetes and high blood pressure that go hand in hand. Having said all of these, a portion of our patients do really succeed in controlling the combined issues, but certainly a few of them are there who don't succeed to achieve a good control, and we as doctor often we prescribe medications. So, as doctors, before we prescribe the medications, our target is to prevent the combined mechanisms of both hypertension and diabetes that causes the organ damage. So among medications, there are obviously several options like the ACE inhibitors, the ARBs, the calcium channel blockers, the cardioselective beta blockers, the diuretics, so on and so forth. But it should always be remembered that for prescribing a medication, it has to be patient selective. Why this is? Because there's a concerning factor that a sudden increase in blood pressure in a patient with diabetes has been seen that it often is leading to a sudden cardiovascular accident, a stroke with paralysis. So, along with prescribing medications, we should always remember that lifestyle modifications is already ongoing. The patient is well aware of what medications he or she is taking, why and which is the best medication available to him or her, what are the still the possible complications in spite of the ongoing treatment, and we as doctors must inform the patient, educate the patient about the warning signs, when to worry and when to bring the patient immediately to a doctor or to a hospital. So, among all these medications and among all the things we have discussed, there are definitely certain guidelines that guide us as well. Among which the RSSDI guidelines, which has been recently published, they mention that calcium channel blockers must be preferred over beta blockers, diuretics, as etc., in combination with ARB or ACEi inhibitor therapy. The guideline mentions that cilnidipine to be the novel molecule, to be the most important molecule, and also being more effective than the other available options of calcium channel blockers, particularly for Indian patients. So it's a grade A recommendation actually, and also it mentions that cilnidipine, when given at a daily dose of 5 to 20 milligram as per the patient's requirement, it facilitates blood pressure reduction, along with there is a reduction of the tachycardia and also reduction of the serum triglycerides. So basically, it's an added advantage. For Indian population with diabetes and hypertension coexistence, the guideline also mentioned that among the ACEi or the ARBs, the most two effective drugs being telmisartan and azilsartan as the drug of choice. So that's all in short about the medication part. And obviously, at last, I would mention that with the lifestyle modifications, as we have discussed, with food habit modifications, the patients really do improve a lot. But obviously, as an individual, you must seek help of a doctor for a more personalized plan. That's obvious. For dietary modifications, also for exercise programs, for the recommended medications on an individualized basis, uh, you must visit a doctor. You must not delay. You must not think it or take it as a very casual thing when you have already diabetes as well as an newly diagnosed hypertension, or the vice versa maybe. So that's overall treatment in short about lifestyle modifications, about the medications part, what are the exercise programs that can be recommended, as well as what are the overall treatment, overall picture for treating a patient with diabetes and hypertension, with a coexistence of both these conditions. So that's all in short. Thank you so much, everyone, and stay healthy.